We are what we eat is a very powerful and a meaningful statement. Now, what do we need to know in addition to this? I'm Dr. Prithvi, Gastroenterologist, and we shall be discussing more about our second brain or the gut. Now, a few days ago, I had a friend of mine calling me regarding bloating, gases, and abdominal distension, which was triggered by the previous evening dinner. Now, interestingly, her husband had the same food, but he was perfectly fine. So, this goes without saying that there are factors beyond food that controls our system. Now, one of that is creating quite a buzz in the field of medicine, and that is bacteria. So, the gut microbiome or the bacteria, there are millions of them in our small intestine and colon. The dysbiosis, or what we call as imbalance between the good bacteria and the bad bacteria, is responsible for a lot of things that happens in our system. Now, why does this imbalance happen? Let's discuss few reasons for this imbalance between good bacteria and bad bacteria. First and foremost, diet. When you take more of processed food, more of artificial sweeteners, well, this imbalance can occur. What do? We take more of good diet, and in addition to that, you would have to take sour curd, kimchi, fermented foods, which helps in the growth of good bacteria. Now, coming to sleep, when there is disturbed sleep, there is disturbed bacterial flora, or in other words, the bacteria sleeps when we sleep, so they need a proper circadian rhythm. Coming to the third, you need to be active for your bacteria to be active. So the good bacteria grows when you are active at least for 20 to 30 minutes in a day. When there's infection, a food infection or otherwise, be it salmonella, so when the gut recovers from it, there will be dysbiosis. And coming to the fifth and most important, abuse or overuse of antibiotics. So please avoid using antibiotics without your doctor's prescription. Sixth, which is more important for the present era, stress. When there is stress, the gut gets affected, and when gut gets affected, it affects the brain. There is a crosstalk between the brain and the gut. So this again affects the bacteria. Now, it goes without saying, when somebody says listen to your gut or your gut instincts, probably we should rethink this statement. We might be listening to our gut bacteria as well. In my next video, we shall discuss a little bit more about gut and brain connection. If you have any comments or questions, don't forget to leave it below. Thank you.